Welcome back to On the Beat, everyone. I'm over here with Dr. John Starr from Golden Triangle Periodontal Centre. Welcome to the show, my friend. Last time you were in, we were talking about what is gum disease, and I really wanted to dig down on this time about how do you treat it, because I know some people, I think you said about 85% of the population, was that the number you said?
About 81 is what the recent
well,
studies.
give or take 4%.
Yeah, there you go.
Okay, are walking around with gum disease. Let's recap very quickly, what is gum disease?
It's the disease of the supporting periodontium for the teeth. It's all the supporting structures, periodontal ligament, alveolar bone, and gum tissues.
Got you. All right. I want to find out, how do we fix it? What are some of the treatments that you do over there?
Well, first you have to understand the history of it. We used to just excise it, remove it, and throw it away, okay, which means a pretty brutal surgery. Now we do a more holistic approach, and we treat the source of the infection, which is the bacteria and the endotoxins, the byproducts left behind from the bacteria.
Right.
And the way we do that, we use a laser the size of one of your hairs, and we run down into the diseased pocket, and the light will go 7 to 10 millimeters in the tissue and kill all the bacteria. And it will take out the darker diseased tissue, the hemoglobin. It's absorbed. It doesn't burn it. It just absorbs it, and it destroys the diseased tissue, and it denatures any tartar, and most importantly, the endotoxins, the byproducts that are swimming around down there, are very toxic. And you can't just scrape those out, because it's like eating soup with a fork. Okay? Wow. And so it cooks that stuff out. We flush it out, seal the pocket, and then your body would regenerate some bone as it heals.
Really?
Yeah.
Okay, interesting enough, we were talking in break that we talked to last time we were here in regards to what are some of the visual signs, and you actually just brought up recently that over excessive bad breath is also a sign.
Yeah, halitosis is a big sign for that, and it's the tight bacteria. If you took some and put them in a little petri dish and grew it, and we'd open it up in this studio, it'd run everybody out of here. It's that bad. And what's interesting, when we do these cases, as soon as we start the laser business, you know, we got all the mask and stuff on, we can still smell it.
Really?
As soon as we start the case, gone.
Okay, I want to ask you something. Does the laser treatment hurt?
No.
And are you having a block injection, or tell me that treatment process?
Here's the process. You come in, we put a little drip in your arm, we give you a little medicine, relax you a lot. You take a little nap, we numb you up, we do the procedure, and when the numbness wears off, there's zero pain. There's no cutting, there's no sewing, there's no discomfort.
So is that what you call a local anesthetic? Or
yeah, it's a conscious sedation IV plus a local anesthetic to numb up the periodontium.
Okay, can you get, or is it hereditary, periodontal disease?
No, it's not hereditary, but it may be your body's immune system's ability to combat the particular bacteria, that there may be a genetic thing to that. So you don't inherit gum disease.
Okay, perfect. But it is an environmental issue, a health and lifestyle.
Oh yes, it's associated with all kinds of diseases.
Okay, I want to ask you, what is the traditional time? Like, I go to the dentist every quarter. I'm a bit obsessive.
That's good.
Okay, I love it. I like getting the clean and the bleaching. I like it all.
Yeah.
But what is the average person? How often should they be getting a clean?
We recommend that you have your teeth cleaned every 6 months, unless you've been diagnosed with periodontal disease or you have dental implants. Then we move you to a quarterly time, alternating with the general dentist. So 4 hours are better than 2, but I'm catching any gum problems quick. The general dentist is catching any decay issues, fractures, and that sort of things quicker, because that's what he does, or he or she does. But between the two of us, we're breaking the bacterial field up every 90 days so you can't get reinfected.
Very quickly before we go, are you saying that I don't necessarily need to be referred by my local dentist to come and see you, or I can just call and see you?
Oh, and we see people all the time that come in that just don't have a general dentist, or sometimes they come to us thinking they're hopeless.
Yeah.
And they're not.
Nothing is ever hopeless.
That's
we
correct.
want everyone to know that. Again, great information. We really appreciate it. If you want to find out more information about Dr. Starr, there it all is up on the screen. Everyone, Golden Triangle Periodontal Centre. Let's go and get your smile looking brilliant. Back after this short break, everyone. You're watching On the Beat.